I'm Steuart Pittman, Anne Arundel County Executive, and I'm here with our Health Officer for Anne Arundel County, Dr. Nilesh Kalyanaraman, welcome.
Thank you.
So I want to talk to you about what we've been calling the coronavirus, which is now called officially something else.
Yes. We started off calling it coronavirus 19, and now we're calling it COVID-19. You'll hear both of those terms, and we use them interchangeably.
Okay, so what is it? Is it just the flu, or is it like the flu? How does it differ from the flu?
So this virus is similar to one of the viruses, coronavirus, that we think that causes the common cold. So all of us have had a coronavirus at some point in our lives. What's different about this is that it's a new type, and it's causing much more severe disease than your common cold. And so it causes some of the same symptoms as the flu, but it's not the flu, which means that the flu vaccine isn't going to help you with this.
Okay. And is that because our bodies haven't gotten accustomed to it, or?
No, it's just a different family. It's like the difference between a monkey and a gorilla. Look kind of alike, but they're not the same thing.
Okay. Okay. So what's the risk to Anne Arundel County residents right now?
So the health department, we're working with the state health department, and they're working with the CDC, the Centers for Disease Control. We're working with the hospitals, Anne Arundel Medical Center and BWMC. We're working with the colleges, St. John's and Anne Arundel Community College, with our federal partners, the Naval Academy, Fort Meade, NSA, BWI, and with urgent care centers and primary care doctors, so that we're keeping on top of what's going on in the community.
Yeah, and I would just add that a lot of the work that's going on right now is preparing for worst case scenarios, or lots of different scenarios. And in fact, in the county, we have our Emergency Operations Center and our Emergency Operations Plan. It's a thick book. I actually have it right here. And within it is that whole Chapter 8, which is all about health and medical services. And there's a list of about 15 just county departments that have work to do if we get into a situation like they've had in China and or Italy and others that we hope we don't have. But we have a staff meeting next week of all the department heads coming together and going through with you and with our emergency operations coordinator what we will do if people do need to start, if we have to start canceling things and quarantining a lot more people.
Yeah.
So what are the symptoms? I mean, if I get a cold and I get a fever, which you've already told us that's the basic symptom. At what point do I call somebody about getting tested?
Yeah. So the symptoms are pretty similar to the cold or the flu. They're cough, shortness of breath, fever, sneezing. And a lot of us have those symptoms, and as long as we can make it through the day, we don't really go to the doctors, right? But when you're starting to have that fever that won't go away, that shortness of breath, which signals a more severe disease, then it's time to go to the doctor. Additionally, if you've traveled to one of the 5 countries where there's significant outbreaks right now, so that's China, Japan, South Korea, Iran, or Italy, and you have any of those symptoms, we also recommend that you go to the doctor. The reality is that...
Or if you've been around people who have traveled to those countries.
Or if you've been around people who've traveled to those countries, or anybody with a diagnosis of COVID-19. I think the reality is that...
Of which there are 0 in Maryland so far.
0 in Maryland.
Fingers crossed.
And we are doing testing of people who are suspected of having, but nobody has tested positive. And one of the things that we know is that we estimate that over 80% of people will have a mild or moderate case who have COVID-19 and will recover on their own without testing. So we know that we're only testing a small portion of the people who might even have it.
And I heard a 1% number, or less than 1%, are likely to actually die from it. Is that?
The number is changing. It's about 1 to 2%, and it's mostly people who are old, so 70 above, and people with other chronic diseases like diabetes or heart failure or COPD.
So, and clearly the key is to get ahead of this and prevent any kind of infection spreading where it exists. Fortunately, we haven't had it in the state, but we've got it in the country. For testing, I've heard on the news that the only place you could get tested was the CDC nationally, and it was taking 3 days, but then recently I heard that that's changed.
That has changed. So that was true until about 2 days ago. So yesterday we were informed by the state health department that they now have the test. And we providers still have to coordinate with the local health department, with the Anne Arundel County Health Department, and with the state health department. But we can
Which is sort of you're automatically, you coordinate with them because you're both a county and a state agency, right?
Correct.
So,
correct.
Okay, good.
And once we coordinate that, the testing will then go to the state laboratory, which is a lot faster to get to, and they can turn it around in about 24 hours. So we can get results a lot faster than we were just a few days ago.
Okay, good, good, good. So how does the testing work? What do they do? Is it blood? Is it?
Yeah, if you've ever gotten a test for the flu, they stick a little swab up your nose. That's the same testing. So they stick a little swab up your nose. They might stick it in the back of your throat. That's the main way. And then sometimes they're taking blood, and that just depends on the person's condition.
So if I get tested and it comes back 24 hours later positive, what happens to me?
Well, it depends on a couple of things. One, it depends if you're in the hospital and they kept you and they're doing testing, then we would work with, the hospital would work with us and the state health department to figure out your course of treatment. You would get care to what we call supportive care, so making sure that you have enough fluids, your oxygen levels are good, taking care of your symptoms to let your body recover. If you were tested and you were sent home, we would ask you to stay away from everybody else while the test results were pending. And if they came back positive, we would then work with that person to do two things. One, figure out how they can stay isolated, and what supports we and the state health department and other agencies could provide to support that. And then two, figure out who else you might have come in contact with to figure out if they need to be tested.
What kind of expenses are associated with this? We know we have people who don't have any health insurance. We know we have people with private insurance with large co-pays. Who pays the bill? That's
a good question. So in instances like this, for people with insurance, that goes through all these tests and the care go through that system. If we need to do additional measures, we have the ability to put resources into place to help people do what they need to do to be able to, for them, A, to recover, and B, to keep the community safe.
Right. And then finally, I guess the big question is, what can we as individuals do right now, or if things get worse, to prevent ourselves from getting infected and our friends and family?
Yeah. The things that we recommend are the things we recommend every cold and flu season. It's the same things. It's making sure that you wash your hands frequently. We tell people to do that with soap and water for 20 seconds. One way to time that is the happy birthday song. The other way is singing the happy birthday song. Or for those of you who prefer, the chorus from Raspberry Beret is also about 20 seconds. So it's a more fun way to do that. Using hand sanitizer if you don't have access to soap and water. Making sure that you cover your sneeze or cough, elbow or a tissue. Wiping down surface. Tuck that in afterwards, button up. Using wipes to wipe down surfaces that come into contact with the public. And then making sure that you, if you're sick, staying home. Talking to either your employer or school, and making sure that you're not getting other people sick. These are the things that we recommend that, like I said, are true for cold and flu season, or just as effective for the COVID-19. That'll help you just stay healthy in general.
Okay. Well, that's all useful information. I mean, I know for me, reading about this and what's gone on in other places and being in a position now where it's my responsibility to make sure that all the county agencies and everybody's prepared for worst case scenarios, it makes us appreciate what we have as we think about what things could be. So hopefully we won't end up in that place, but we're a strong community, and I know we're all going to pull together. Thank you for what you're doing.
Thank you.
All right.